Okay, Lance slash Dr. Schmidt.
Yeah, we're friends. You call me either one. Whatever comes next. It'll be Lance, probably, yeah.
Lance owns Reflections Dental Care. And when I walk in, it's really hard for me to say I'm here to see Dr. Schmidt.
I've been called worse before, I promise. So Lance or Dr. Schmidt, I don't hear any difference between the two. So
okay, good.
Roll with it. You're good.
Formality. Okay, so we've known Lance for a long time, fraternity brother of my husband, and they're some of our best friends. And so we just love Lance and stuff. And I thought we needed to hear from Lance about his new practice that has opened and his second location.
Yeah.
In addition to the other one he has at Hefner in May. Oh, no, not Hefner in May. Hefner in Portland.
It is Hefner and Hefner. Hefner Road and Hefner Parkway.
Yeah. Oh yeah, Hefner and Hefner. That's much easier to remember. Okay. Okay, let's talk about your new location because I think can you say a dental office is sexy? I think it's super sexy and like uber mid-century. It's got all the like stylish vibes.
The decorator and my wife did a really great job. Yeah, I think they knocked it out of the park. Yeah, and the architect too, right? I mean, the architect had a big part of it, getting the bones and the skeleton up to speed, and then the decorator and Stephanie worked together, collaborating on the colors and fits and finishes, and it feels great when you walk in. So thanks.
Yes, super sleek, and the outside's real fun. And okay, so where is the new location?
New location is at 16th and Classen, Northwest 16th and Classen. We're kind of in the middle of a bunch of different areas, and no one can really claim us as their own. The Plaza wants to claim us, but we're outside their area. Gatewood, not quite there. We're Classen, 10-Pin, Gatewood, Midtown, Plaza, Uptown. We're kind of right in the middle of all of that.
You're all of them.
Yeah.
I love it. You can't put you in a box.
Never have been able to.
Okay, and so you have a fabulous mural. Tell us about the artist and some backstory.
Yeah, Vanessa Wolverton is the interior designer who collaborated with us on the project, with the architect and with my wife Stephanie, and myself a little bit. But she has a friend named Creed Bayless, who I think they went to high school together, and Creed loves to do art and do graffiti art. And since we're in the plaza, and we thought it was very fitting to do a mural as a centerpiece, a focus piece in our waiting area. So when you walk in, you notice it right away, you can't miss it. And Vanessa and Creed had a great idea to put a gold tooth in the smile, which livens up the vibe as well.
I love that part.
It's a shiny gold tooth. When the lights are just right, you can see the shine of the gold. It's not just paint. It's not just graffiti paint, but it's shiny gold. It's awesome.
I love it. I love it. That is the crowning glory of the mural for sure. Okay, so let's talk about, you got to order like all the newest equipment.
We did. Yeah, nearly all of it came off of a boat from Germany. It was ordered months and months ahead of COVID. So thankfully, we didn't have many delays on the shipment of the equipment. We had lots of delays in the installation. Naturally, with all the things happening, trying to open up a new practice in the middle of a pandemic. But yeah, it's the latest and greatest technology. Europe, in the United States, we like to think that we're ahead of the curve on lots of things. We're pretty ethnocentric, and I'll put myself squarely in that box. It's one of the few boxes you can put me into sometimes. But Europe does a really, really great job in leading some of the technologies. And we borrowed a page from their playbook. It's the equipment's really, really phenomenal, and it's the latest and greatest in both technology from the user perspective, as in the clinician and the assistant and the hygienist, but it's also really great from a sterilization and disinfection protocol.
Okay, and so what does that mean for your patients?
Yeah.
What are the benefits?
Yeah, so the benefit for the patient, especially for the disinfection and the sterilization protocol, is that we were able to clean the chairs very efficiently and very thoroughly without having to jump through a lot of hoops and steps. So between patients, we can do a lot of things very quickly and efficiently to make the patient very safe when they sit down in the chair.
And in the midst of COVID, that's crazy important right now.
It is so important. And a number of our things in our sterilization center are also modern as well. And a lot of it's touch-free. So that assistant is able to walk in, the hygienist and the dentist are able to walk in and take care of things without ever having to really touch anything other than what their gloves are already touching, their dirty instruments. So there's a lot less chance and risk for cross-contamination. So cross-contamination would be defined simply as there's a lot less chance for the ability for one patient to infect another patient and then never having actually physically been together, so that we're able to handle those instruments in a very clean and efficient way.
That's crazy important right now. Okay, tell me, like, how long have you been practicing? How long is the new office? The old, original, not old. It's awesome too. That's where I go. Yeah. Original office.
Yeah, we've had to be careful not to use the word old because it has a lot of the same technologies as our current office. It's been that the building was built in 1999, and I got there and took over the practice in a very small practice in 2004, right out of my residency. So I graduated from dental school at OU in 2003, and then I did a 1-year elective residency in advanced education and general dentistry. And so I've been there for, it's hard to do the math, but 16 and a half years. And we opened up this practice in June. So this practice is, the newest location's been open for 7 months, 8 months.
Okay, so this makes me think, we need to talk about what do you call your day when you have people come in for free?
Yeah, it's called Dentistry from the Heart. This is the first year we have not done Dentistry from the Heart in, golly, I think we had 2020 ended our streak of 5 years of doing Dentistry from the Heart. And the thing that really killed it this year, or last year for us, was COVID-19 and dealing with all of the aftermath and the whirlwind that created in everyone's lives. Yeah, so Dentistry from the Heart, we'll pick it back up again ASAP. It's a free dental day. We open up our office and we have we accept all adult patients, and we do extractions and fillings and cleanings, and it's one of our best days. I mean, so much great comes from those days and stories from patients who are in the chair, and it's a great team building day as well. So I know it sounds a little bit selfish to talk about ourselves and the day that we're giving to others, but I think that it's true. We have a great team period on a regular working day when we're seeing patients in a normal way, but that day it's special.
I love that. I love that you do that, and I know that makes a huge impact. I mean, how many patients do you get to see in that day?
Golly, it's a good question. I can't think of the number of patients off the top of my head. I know that, I know it sounds weird to talk in dollars given away, but I can remember those numbers and round numbers. So right about every year we do about $30,000 worth of free dentistry, and on average. So over a 5-year period, it's a big number.
That is a big number. Yeah. That's a huge difference, especially for people who don't have access to that. Okay, so speaking of teams, let's talk about it's not just you and your gorgeous hygienist staff. There's a whole bunch of you.
There are a lot of us, yeah, which is why I did not name the practice Lance R. Schmidt from the very beginning. It's been Reflections Dental Care for a really, really long time because I never wanted the practice to really be centered around me and for me to be the focus. But yeah, we have a huge team. We're over 22, I think we have 22 people on the team. We just made a few new hires last week to accommodate some growth and some turnover. We have one person that's leaving us to go to nursing school, so she's moving on, and we're one of those new hires is to replace her. But yeah, we're 22 strong. We have 4 dentists now, and a new dentist will be added in August. She's coming in straight out of her residency, the same residency that I did after dental school, advanced education and general dentistry. So we find an incredible benefit in having a large team of providers.
Well, and having each dentist who specializes in different things helps immensely as well.
It's true. Dentistry, decades and decades ago, dentistry had very few options available for patients and for dentists. It was pretty, the treatment planning was pretty simple. However, like all professions and like all technology, things have changed rapidly with research and innovation. And it has become extremely hard to keep up with each of the disciplines of dentistry and to do them really, really well with excellence. And so what we have found is with a team of dentists is that we can all individually lean into our areas of special interest within the disciplines of general dentistry. And then we are able to refer to each other within the practice based on our special areas of interest. And that's a huge benefit. We find that patients are able to stay within the ecosystem of reflections dental care and get great care. So, to use an example of that, we had a patient come in for a sedation appointment. We had an anesthesiologist. We're one of the few offices in the city that I know of that has a permit and is able to bring in an anesthesiologist to care for our patients. So, in the morning, a patient went to sleep. Dr. Bacchus was able to do some fillings and some crowns. Then one of the hygienists came in and did a cleaning, and Dr. Greenlee came in and did a root canal, and then I finished up the case and did some extraction and some bone graft and an implant. And the patient woke up and all of that care was done. In a typical situation in a typical dental office, that patient would have to travel around the city and the metro area to get care with a number of specialists and be sedated a number of times, take off work a number of times, have a recovery period a number of times. And also, a lot of those patients are dentally anxious, like highly focused on being in a dental office and having dental care done. So just the anxiety alone of having multiple appointments is mitigated by having just one appointment with one office and staying within the reflections dental care ecosystem. So there's incredible benefit for the patients. And there's great benefit for the dentist because we get a chance to do a lot of the things that we love and then refer to each other for those things that we don't necessarily like doing.
That's really amazing. That would save so much time and money and taking off work. I mean, what a great example of the beauty of your practice. Let's talk about dental anxiety because that's a thing, right?
No thing, sure, yeah.
What do you guys do to help people with that?
Yeah, so in addition to the anesthesiologist, we have a comfort menu. So when patients come in, we have a menu of options available for patients. So weighted blankets, warm blankets, we have headphones that can go over a patient's ears. We have iPads that hover over the top of the heads of the patients if they want them to. And they can do a number of things on those iPads. They can watch TV, watch a movie, they can listen to music, they can watch a concert on YouTube. Anything that they want to do on that iPad to help take their mind and focus off the appointment is available. We have nitrous oxide or laughing gas, synonymous terms for a gas that helps patients relax. We'll prescribe Valium for patients if they want it or need it. And also, some of the things that aren't directly on the comfort menu that we do to help patients feel more comfortable is we ask patients when they come in what their goals are and what their limitations to getting treatment are and how much information they want. For instance, some patients really want to focus on the cosmetics. And so we look through that lens and speak through that lens when having conversations with them about their diagnosis and treatment planning. And other patients don't necessarily care as much about the cosmetics. They really care about the function and longevity. So we'll speak and talk directly about that. And then some patients, their limitation is not necessarily fear, but their limitation is time. And so we'll make sure that we're treatment planning to minimize the number of appointments that they would have to come in and have procedures done. And we're also minimizing the amount of time that we're talking with them about those procedures because they value their time, right?
Right.
And also the amount of information that some patients demand is extremely large. And those patients want to sit down and talk a lot about what's going on and what to do and have a lot of questions. But some patients, they just want the bottom line. And they don't really necessarily need to talk a lot about things. And so we don't bore them with over speaking and over talking. We don't waste their time. So we take all of those things into account to keep them more comfortable and speak directly to what their desires and wants and limitations are.
That's so good. I love that. Let's talk about technology.
Yeah.
Because you've got lots of it.
We are loaded with technology. One of the coolest things that we've added to both the original location and this location, we added the 3-dimensional Cbct machine. So it's a cone beam machine that allows us to take 3-dimensional digital x-rays. So instead of just looking at x-rays 2-dimensionally, we're able to see our patients in 3D, both bone and teeth. And the more you see, the more you know. And we know from research that an abscessed tooth is not going to show up about 1/3 of the times in a 2-dimensional x-ray. So our 3-dimensional x-ray allows us to be able to see more and pick up things that we're not able to see 2-dimensionally, to include the volume and position of bone around teeth, or volume and position of bone, even in the presence of no teeth, so that we can treatment plan for implants to help retain dentures, or so we can treatment plan for implants so that patients can throw away their denture and then have something that's more fixated and does not come in and out of their mouths.
That's amazing. What about the time frame it takes to get like a crown done? And are there some things you do in-house that make those processes go quicker so you're not making multiple appointments?
Yeah, that's a good question. Yeah, I forgot to talk about that when we talked about that sedation patient. So when Dr. Bacchus was the first clinician in the room, and she did the fillings and the crown, we have a machine called a Sargeant machine, and it mills crowns same day. So she was able to deliver that crown on that patient while the patient was asleep, so that highly phobic and anxious patient doesn't have to come back and have the crown delivered either under anesthesia or dealing with the phobia of all the things that come with being in the chair. So yeah, we do make a lot of our crowns in-house. We have a porcelain milling oven. We have special stains to color teeth to the specific shades to match the neighboring teeth. However, when we do an anterior case, when we do a cosmetic rehabilitation on a patient, and there's a lot of crowns that are sitting front and center that are going to be that we want exactly right in their shade and shape and contour and topography, we will send those to a technician, an artist, who does an amazing job of making us look really good. Their art and the teeth that they make look, the dentistry that they do, the teeth that they make for us, the dentistry that we're able to do with them, it's just, it's amazing. We're able to make teeth, let me change that. We're able to make dentistry look just like teeth, so that when you look at someone's smile, you don't, your eye isn't attracted to something a little bit off or a little bit different, because our lab is so good at making the colors so great.
That's really awesome. It's such a vulnerable thing, right? Your mouth and your smile and you have to treat it with such care with people. Am I making the right point?
No, it's so true. It's a very sensitive area in people's bodies, and I think I totally agree with you. Yeah, it's a very it's not only a very sensitive area, but patients who go through similar surgeries in a medical setting, in a medical office, they're oftentimes going to be under anesthesia. However, in dentistry, we have this situation where patients are extremely vulnerable, lying in the chair, oftentimes fully awake and fully conscious and aware, with all the sounds and smells and visual cues about what's happening. And like I said, in a typical medical setting, an MD is typically going to sedate a patient for that, and the patient will wake up with no memory. However, in dentistry, it's that's where most of our patients are. They're able to get care done, consciously and knowing what's going on. Doesn't mean it's fun. Doesn't mean it's necessarily the best. I'm sure patients would rather be eating at a restaurant or going to do something else fun than spending their time in a dental chair. However, the benefits of taking care of your teeth are tremendous. I mean, too often we've separated the mouth from the body in U.S. culture, and mouth health, dentistry, and medical health or overall physical health has been separated. However, they're very much the same.
And things having to do with your mouth, if not taken care of at the right time, can lead to all sorts of probably medical issues as well.
Absolutely. Yeah, the research is really clear. The more teeth you lose, the less healthy you can be, because you can't eat foods that are healthy. So the more teeth that are lost, the more likely you're going to gravitate towards the processed foods that are not as great, and leaving the salads behind and the more healthy foods. So yeah, the links are tremendous, both from the foods you're able to consume, and also the link from the mouth to the body when you consider periodontal disease, gum disease, and its effect on the overall body. Just the body really, really hates chronic inflammation, and that is exactly what periodontal disease is. And so by not treating it, the body is constantly trying to fight off something it can't get rid of, and that inflammation that's present and the bacteria that's present in that situation leads to poor overall health and poor cardiac health as well.
Goodness. Oh, go get your teeth cleaned. Seriously. Okay, let's talk about, you're going to have access to some people with being a language. Let me start over. Cut that. How do you ask that question in a better way? Let's see. So you're going to be able to serve people who speak other languages besides English soon, right?
That's exactly right. Yeah, we're really excited about that. So one of our newest dentists is Dr. Nguyen Holland, and she has been practicing, over 20 years. My wife and I started working for her back in circa 2004. And my wife worked for her for nearly 15 years, on average about one Saturday a month in her practice. And she sold her practice about 2 or 3 years ago. She's fluent in Vietnamese. That is her first language. And she's fluent in English. She's also fluent in Dentalese, which is a totally separate language. So she speaks 3 languages. And we're really excited about that. Also, we're in some of these new hires that we've just made, we're able to serve the Spanish-speaking population, the Latino population of Oklahoma City. And the great thing about those additions to our team is that almost from the time they call the office to the time they check out, they can speak their native tongue in Spanish, and we'll be able to serve their needs. So that's really exciting for us too.
That's huge. Last thing, because we love to eat at restaurants with you guys.
Yeah.
It's our thing that we do, and we like to try new ones. Okay, so favorite restaurant, and when you're there, what are you going to order?
Yeah, favorite restaurant. I have to look through the lens of my favorite restaurant to eat at with my wife. We love date nights. We love pre-COVID date nights.
Yes, right.
When we were eating at a restaurant indoors, or on the patio in comfortable weather. And so that restaurant has to be Cheevers. It's just a solid choice. It's great every time. I think we've only had a bad experience one time in the many, many years we've been going there. And so I think it's the best spot for us to go. And it's Old Faithful. Even if we decide, if we get a last minute chance to go have a date night and we decide to go to Cheevers, it's typical they won't have a table for us, so we'll just belly up to the bar and eat there. Let's see, dish at Cheevers. Sometimes we'll split the chicken fried steak, but if we go solo, I'm generally getting the halibut. I think the halibut's strong.
I've never tried that. The chicken fried steak is my favorite, and Cheevers is my number one. So that's why we're friends with you guys, right there in a nutshell. But based on restaurant choice solely.
It's a great spot.
Okay, Lance, thank you for your time. Okay, if they want to find you, what's the best way to book an appointment?
Yeah, reflectionsdentalcare.com. We have lots of people. We have just one person dedicated to answering the phones and filtering phone calls to speak directly to new patients. So that's great. And that person, like I said, it's just their main role is to field phone calls and answer questions. So feel free to call us. Our websites, we get compliments on our website. There's a few things that I would change. I think that's typical of any any business owner that always wanting to make things better. But we'll be putting online chat back on the website within the next few days, and so patients who don't want to talk on the phone, who would rather just chat with that same person that would normally answer the phone, they'll be able to do that, and they can schedule online with that person via chat.
That's great. What if somebody wanted like a consultation?
Yeah, we do that all the time. Yeah,
okay.
We do that all the time. Yeah, we're happy to give consultations. We do a number of consultations. We'll do cosmetic consultations, implant consultations, new patient visits. So yeah, we'll also do a second opinion visit if we need.
That's a good thing.
Patient wants,
yeah. Okay, I love that. Okay, everybody needs to go to Reflections and see all the fabulous dentists and the numbers growing, and the hygienists. And everybody's so nice, and my kids love it, especially the iPads.
Yeah, those are great. Yeah.
I'm partial to the warm blankets myself.
It's a favorite. Yeah, we keep it pretty cold in the back, which is, I guess, probably typical of a restaurant or in a typical medical setting. But we know patients are not always comfortable cold, so we love the warm blankets too.
Yeah, way to take care of people.
Thanks.
Okay, thanks, Lance.
Thanks, Lauren. Appreciate it.